Hi, everybody. I'm Piero Saieva. I'm an internal medicine registrar from the at Hospital, which falls under the University of Cape Town in South Africa. I'm going to be talking to you about a case of acute flaccid paralysis in pregnancy. This is the beautiful Cape Town skyline with Table Mountain, Devil's Peak, and Signal Hill there that we get to wake up to every single day. So the case, it was a woman in her early 30s. She was gravid 2, parity 1 at 34 weeks gestation with sober habits. Her presenting complaint was that of collapse and flaccid paralysis with preserved reflexes. Her vitals were within normal limits, no vomiting or acute diarrheal illness of note. Further history showed no history of any kind of supplementation or new medication, no recent viral illnesses, no back pain, no fatigability. Family history, there was no family history of any chronic conditions. This is her initial biochemistry, the sodium of 143, potassium of 2.5, her aspartate aminotransferase of 634, her lactate dehydrogenase of 896, her creatinine kinase of greater than 22,000, and her urine potassium low at 4.6, which has no urinary or renal losses of potassium. So if you're like me and you're going through your hypokalemic approach, you'll say something's missing here. And I went back and forth with this lady for 30 to 40 minutes trying to figure out what are we missing. And eventually, the missing link was that she'd actually been consuming several bags of umhlaba, which is kind of a clay-enriched soil, every single day over the past few months, which essentially was we identified a frequently overlooked form of pica. These are the bags of umhlaba that she was mixing with water a couple of times a day that she was getting in her local informal settlement where she stayed. Just from a cultural context point of view, in the isiXhosa culture, umhlaba translates to the whole earth and sky, and its ingestion reinforces the patient's spiritual connection to her ancestors while also meeting her cravings for pica. From a mechanism point of view, I'll elaborate on a bit later, but essentially clay acts as a gastrointestinal binder to potassium ions, which directly causes severe hypokalemia and subsequent rhabdomyolysis. Just to round off the case, we did replace her potassium. Potassium slowly increased up to 4. Her AST, LDH, and creatinine kinase all slowly decreased during her stay. I can confirm that she walked out of hospital very happily and delivered a healthy baby. Just to quickly go through the pathophysiology, because I found this incredibly interesting for me. So as I said, she ingested this umhlaba over the course of a couple of months, multiple times a day. And this caused intestinal binding with the potassium. This is due to a cation exchange with the potassium being slightly positive and the clay having a negative charge. On top of that, clay actually has an octahedral sheet on top of 2 tetrahedral sheets, and the potassium ion is one of the few ions that can actually fit directly into those gaps, causing it to bind there and not being able to be released. That binding causes severe hypokalemia. The hypokalemia essentially causes endothelial and smooth muscle dysfunction. The vessels cannot dilate to allow for more blood flow to go into the muscle. This is quite critical in times of exertion, as you need more blood flow into your muscles. That kind of persistent hypoperfused state causes muscle ischemia. That muscle ischemia eventually causes breakdown, necrosis, which then leads to the intracellular context becoming extracellular, causing our rhabdomyolysis in this case. So I thought instead of giving everybody a hypokalemic talk again, I thought we'd rather speak about pica and geophagia. So pica is the persistent ingestion of non-nutritious substances, with geophagia is the ingestion of earthly substances. It's an ancient and widespread practice, actually initially documented by Hippocrates, specifically in pregnant women. From a cultural and medicinal point of view, it's very deeply rooted in African culture, and some studies in South Africa and across Africa show that certain population groups have about an 80% population prevalence of having ingested some form of earthy material to receive treatment for various conditions. And it's got variable clinical impact, and that depends entirely on what you're taking in, how much of you're taking it, and the frequency and duration that you're taking it in. There have been noted some potential benefits depending on what's ingested and according to the patient's micro or macronutrient deficiencies. However, in South Africa specifically, we note excessive content of heavy metals, so lead, nickel, copper, and iron in our soil. There's also increased rates of helminthes infections, such as Ascaris lambicroides and Trichuris trichuria. And there have been cases of bile obstruction, specifically linked to ingestion of kaolin-rich soil, which binds quite a lot of water, and bile perforation due to ingestion of quartz crystals. To me, there were 3 main learning points that I got from this case. Firstly, mindful history taking. it was very, it took some time to develop the right approach, to discuss this with her and allow her to feel comfortable enough with me to acknowledge what she was going on at home. And I think that was really special, that we were able to avoid lots of tests, lots of money being spent on her. She was terrified of needles, so we were able to address that as well, without any kind of advanced imaging or anything else that was needed, just by taking a decent, thorough history. Secondly, because we were able to get to the root cause of this, not only did we sort out the hypokalemia, but we were actually able to sit her down, speak to her about her pica cravings, and get to the bottom. She actually ended up having an iron deficiency, and addressing how we can approach that with her and what's a safer way for her to treat this in the future. And then lastly, suspect pica, specifically in pregnant patients with unexplained electrolyte disturbances or muscle weaknesses. It obviously depends on what's in your soil compared to what's in our soil, but it's something just to keep at the back of your mind. And these are my references.